Which of the following effective method for routine hand hygiene? The correct answer is option C, alcohol-based hand rub. Alcohol-based hand rub kills 99% germs and is faster than soap unless hands are visibly dirty. The next second question, WHO recommends hand washing duration of. The correct answer is option C, 20 seconds. World Health Organization hand wash technique officially require 20 seconds. Next question, 5 moments of hand hygiene introduced by the correct answer is World Health Organization. World Health Organization created global hand hygiene guidelines. The next question, universal precautions prevent the transmission of. The correct answer is option C, HIV, HBV, HCV. Universal precautions target bloodborne pathogens. Most common method of hospital infection transmission. The correct answer is option D, hands of healthcare workers. N95 mask filters at least. The correct answer is option D, 95%. Chlorine concentration for surface disinfection. The correct answer is option B, 1%. Yellow bag in biomedical waste management is used for. The correct answer is option C, human anatomical waste. Airborne infection isolation requires. The correct answer is option D, negative pressure room. Standard precautions should be applied to. The correct answer is option D, all the patient. Which disease spread mainly through droplets? The correct answer is option B, influenza. Then contact precautions are required for. The correct answer is option C, MRSA. Most resistant form of microorganism. The correct answer is option B, bacteria, spores. Sterilization destroys. The correct answer is option D, all the microorganisms including spores. Disinfection destroys. The correct answer is option B, most pathogens but not spores. Autoclave standard temperature. The correct answer is option C, 121 degrees Celsius. Autoclave pressure required. The correct answer is option C, 15 psi. Ethylene oxide sterilization is used for. The correct answer is option C, heat sensitive equipment. Main purpose of PPE is to. The correct answer is option C, protect from exposure. HIV is not transmitted by. The correct answer is option D, casual touch. Safe method of needle is done by. The correct answer is option C, puncture-proof container. Hand hygiene should be performed. The correct answer is option D, before and after touching patient. Immunity after vaccination is known as. The correct answer is option C, artificial active immunity. Which disease required airborne precautions? The correct answer is option D, all the above. Best method to prevent catheter associated urinary tract infection. The correct answer is option D, aseptic insertion technique. Which precaution is required for C. difficile infection? The correct answer is option C, contact precautions. Next question. Hand washing with soap and water is mandatory when? The correct answer is option C, hands are visibly dirty. Alcohol hand rub does not remove visible dust, blood, mucus. High level disinfection is used for. The correct answer is option C, endoscope. Endoscope or semi-critical instrument need high level disinfection. Which method sterilizes liquids? The correct answer is option D, autoclave. Autoclave sterilizes culture media liquids safely using steam under pressure. TB spreads mainly through. The correct answer is option C, airborne droplets. TB bacilli remains suspended in air for long duration. First item removed during PPE doffing. The correct answer is option C, glove. Gloves are usually most contaminated. Best method to prevent ventilator associated pneumonia. The correct answer is option D, elevated head of bed to 30 to 45 degree. Color of bag for contaminated plastic in biomedical waste. The correct answer is option D, red. Surgical mask mainly protected from. The correct answer is option C, droplets. Best disinfection for blood spills. The correct answer is option C, 1% sodium hypochlorite, strongly effective against viruses in blood, HBV or HIV. Sharp injury should be reported. The correct answer is option D, immediately. Early reporting allows PPE for HIV or HBV. Minimum alcohol concentration in hand rub. The correct answer is option C, 60%. Effective antiseptic action begins at more than or equal to 60% alcohol. Fumigation uses. The correct answer is option D, formaldehyde. Used needles should be disposed. The correct answer is option B, without recapping. Hot air oven sterilizes at. The correct answer is option D, 160 to 170 degrees Celsius. Dry heat sterilization for powders, oils, glassware. Black bag is used for. The correct answer is option D, general waste. Transmission based precautions include. The correct answer is option D, airborne droplet contact precautions. Instrument used to check autoclave temperature. The correct answer is option C, thermometer. Blue container is used for. The correct answer is option B, glassware. Skin disinfectant before injection. The correct answer is option C 70% alcohol. Risk of hepatitis B infection from needle stick injury. The correct answer is option C 30%. Best PPE for airborne infection. The correct answer is option C N95 respirator. HCAI stands for. The correct answer is option C healthcare associated infection, which spreads mainly by contact transmission. The correct answer is option D MRSA. Methicillin resistant Staphylococcus aureus. First step in WHO hand hygiene techniques. The correct answer is option D. Apply enough product to cover hands. Okay. Ideal contact time for 70% alcohol during disinfection. The correct answer is option B 20 to 30 seconds. Alcohol needs 20 to 30 seconds to kill microorganism effectively. Which PPE is required during suctioning? The correct answer is option D glove plus mask plus eye protection. Suctioning causes splashes, so faces protection needed. Main reservoir of hospital acquired infections. The correct answer is option C patient. Many patients carry pathogens unknownly. Most commonly missed area during hand washing. The correct answer is option D thumb. Which disease requires N95 mask strictly? The correct answer is option D tuberculosis. TB spreads by airborne particles. Disinfecting blood spills requires. The correct answer is option B 1% bleach solution. Which is that dry heat sterilization method? The correct answer is option C hot air oven. Droplet infection spread up to. The correct answer is option C 1 meter. Best solution for hospital. The correct answer is option C chlorhexidine plus alcohol. Chemical waste is disposed in. The correct answer is option D black container. Spores are destroyed by. The correct answer is option D sterilization only. Glutaraldehyde is used for. The correct answer is option B endoscope. High level disinfectant for head sensitive instrument. Low level disinfectant among the following. The correct answer is option C phenol. Strict contact isolation is required for. The correct answer is option C difflil. C deficit produces spores resistant to alcohol. First line of defense against infection. The correct answer is option C hand hygiene. Which instrument must always be sterilized? The correct answer is option C surgical instrument. N95 mask must be fit tested. The correct answer is option C every time before use. Shops container should be filled up to. The correct answer is option C 75%. Which method removes organic matter from surfaces? The correct answer is option C detergent plus water. Airborne transmission occurs in. The correct answer is option D all of the above. Strongest disinfectant among the following. The correct answer is option C sodium hypochlorite. Biological indicator for autoclave. The correct answer is option C bacillus styrothermophilus. Isolation room must have. The correct answer is option C proper ventilation. COVID-19 mainly spread via. The correct answer is option C droplet and aerosols. Best way to prevent surgical site infection. The correct answer is option D proper sterilization of instrument. Which method kills all microorganisms including spores? The correct answer is option D sterilization. Sterilization destroys all forms of microbial life including spores. Common hospital floor disinfectant. The correct answer is option C 1% phenol. Phenol is used regularly for routine floor cleaning. Most needle stick injuries occur due to. The correct answer is option D recapping needles. Recapping is the most common cause of needle stick injury. Incineration is used for. The correct answer is option C human anatomical waste. Safe distance for droplet precautions. The correct answer is option B 1 meter. Which level of disinfection kill mycobacterium tuberculosis? The correct answer is option C high level disinfection. Chemical used for surgical hand scrub. The correct answer is option B chlorhexidine. Contact time for 1% bleach for surfaces. The correct answer is option C 10 to 12 minutes. Fecal oral transmission occurs in. The correct answer is option C hepatitis A. Most common hospital acquired infection. The correct answer is option D UTI. Most UTIs are catheter associated. Best way to prevent needle stick injury. The correct answer is option C no recapping plus proper shops disposal. Standard autoclaving time at 121 degrees Celsius. The correct answer is option B 15 to 20 minutes. Blue bag or container is used for the correct answer is option B glassware. Droplet precautions require the correct answer is option D surgical masks. Most effective method to prevent cross infection, the correct answer is option D hand hygiene between each patient. Airborne infection examples, the correct answer is option D TB, measles, chickenpox. Low level disinfectant used for BP coughs, the correct answer is option C 70% alcohol. Goggles protect mainly from option D splash of blood or body fluids. Biomedical waste management rules in India. The correct answer is option C Biomedical rules 2016. Rapid emergency sterilization method. Biomedical waste management rules in India introduced in the year. The correct answer is option C 2016. Rapid emergency sterilization method. The correct answer is option B flash sterilization. Sharps are disposed in which container? The correct answer is option C white puncture proof container. Fecal oral diseases include the correct answer is option B hepatitis A and E. Which mask protects from both airborne and droplet infection? The correct answer is option C N95 mask. Best hospital waste management practice. The correct answer is option D segregation at source. Final step in hand hygiene procedure. The correct answer is option D air drying hands.